I'm Jared Weiss, advocate and board member at the Lung Cancer Initiative of North Carolina, vice president of cancergrace.org, and a thoracic oncologist at Lineberger's Comprehensive Cancer Center at University of North Carolina. The American Cancer Society just released their 2020 Cancer Facts and Figures. All citations in this presentation come from ACS. And this report showed some very good news, in particular driven by lung cancer, that it is my pleasure to share with you today. The cancer death rate rose until 1991, then fell continuously through 2017, resulting in an overall decline of 29%. That translates into an estimated 2.9 million fewer cancer deaths than would have occurred if peak rates had persisted. This was driven largely by lung cancer. Here we see a dramatic decline in death from lung cancer in men. Unfortunately, the decline is less dramatic in women, but you do see that decline happening. A decline in mortality can come from two major sources. We can have less incidence of cancer or fewer new cases, and/or we can have fewer deaths amongst those who do develop cancer. And happily here we have both. Here is incidence of lung cancer in men over time, and you see that between 1975 and 2016, we have a lovely decline in cancer incidence, shown in the red curve. And in women, again, a less impressive curve, but at least it is not getting worse. APC stands here for annual percentage change. And what we're looking at are year periods and the average annual percent change during that period. So what we see is that in the 1975 to 1980 period, we have a 3% annual percent change in the wrong direction for lung cancer. In 1980 to 1990, it's not as bad, but still increasing, 1.8% annual percent change. It starts flattening out in 1990 to 1995 with a decline of 0.2%. That starts to show a clear trend between 1995 and 2005, down almost 1% annual percent change. This accelerates between 2005 and 2014 to an annual percent change of a decline of 2.4%. And if you drill down into this data on a more granular level, in the most recent years, it looks like there's an acceleration in this trend, very much in the right direction. In 2014 to 2017, a negative 4.9% annual percent change. This is wonderful. For a long time, we've had no movement in 5-year mortality in lung cancer, comparing the 1975 to 77 period to the 1987 to 89 period. We had no change in 5-year mortality. While a 21% 5-year survival is nothing to celebrate and shows how much more work we have yet to do, still it's worthy of celebrating the dramatic improvement. So where did all of this come from? It's beyond the scope of this brief podcast to drill into detail, but I do want to share the basic themes of where I think this came from. The best way to prevent dying of cancer is to not get cancer in the first place. While smoking is not the only cause of lung cancer, it is certainly the dominant etiologic factor, and smoking rates have declined. We have a long way to go, though. Ideally, the smoking rate in America should be 0%. While that would not prevent all lung cancer, it would make a big difference. The second choice, if you can't prevent cancer, is to catch it at an early stage. We finally have effective screening for lung cancer that will hopefully result in more patients being caught at curable early stages. And for those who do still get stage 4 or metastatic incurable lung cancer, we have dramatic improvements in our therapy with the themes of lesser toxicity and greater efficacy. When we can match an actionable driver mutation with a targeted therapy, as a theme we get treatments that are less toxic and more effective. For other patients, immunotherapy has famously improved care, notably including a small but real proportion of patients with durable control and perhaps even cure. Critically, not only for quality of life, but also for duration of life, we've had improvements in supportive care. And so finally, we have something very real to celebrate. It's a pleasure to share it with you. Of course, there are still many patients still suffering and dying of lung cancer and a lot of work to do. But at least these statistics show that all of the efforts that advocacy organizations, researchers, patients and their families, clinicians and clinical trialists have made are moving the needle in the right direction.